Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about how to treat burnout syndrome at work. Burnout syndrome is a long-term stress-related illness. Burnout syndrome typically develops when you feel overburdened, emotionally spent, and unable to accomplish your professional goals. Your performance at work will suffer if burnout syndrome is not recognized and treated right away. Physical and emotional health will be impacted by this. How should burnout syndrome be handled? Work may definitely sap your resources, time, energy, even emotions. It's normal to experience moments of feeling helpless and unappreciated. However, if you consistently feel this way, you might be suffering from burnout syndrome. When stress and pressure are carried for too long, the result is eventually frustration and frequently self-disappointment. Burnout syndrome can have a negative influence on both your physical and emotional well-being. When performing daily tasks, you'll get weary soon. Additionally, when your immune system deteriorates, you become more prone to ailments like the flu and headaches. Your sleep and hunger are both messed up. Burnout syndrome symptoms develop gradually and move from one issue to another rather than appearing suddenly. Fortunately, there are a number of strategies you can use to treat burnout syndrome. 1. Understanding the issues that you must deal with at work. You need to first be conscious of the issue at hand in order to overcome burnout syndrome. List the many work-related issues or situations that frequently cause you stress and panic attacks, if necessary. When this occurs, try to apply a solution or action you would do in the same circumstance. Don't worry if this strategy has little effect. It will take time to overcome burnout syndrome, but keeping your attention on the minor adjustments you have made can help you remain calm. 2. Look for support from those near you. In essence, humans are social beings who depend on one another. Humans also require communication, especially during times of sadness and helplessness. Discussing your issues with those who are closest to you, such as family, friends, and partners, may help you get over the burnout syndrome symptoms. You don't have to be fixated on the solution you will receive. Sometimes all you need is someone who can be a good listener and able to accept complaints without passing judgment on right or wrong. Speaking with co-workers might also make you feel less stressed. Who knows, maybe you two may discover a technique to conquer burnout syndrome together, especially if they have personally experienced it. Socializing outside of the workplace is also crucial. You will learn more viewpoints from other people and become more imaginative at work. 3. Appreciating your job's benefits. Recall the motivations that kept you going. It's not just about your professional accomplishments. Even the little things, like laughing with friends, having a welcoming and convenient office, or enjoying a delicious lunch, may be enjoyable. Inform HR or your office boss if the work still makes you feel dragged down. You might be able to solve the current issue. Avoid forcing yourself to multitask because it will harm you. Burnout syndrome must be addressed, even when you are getting well. Your stress level can be decreased by concentrating on one task at a time and taking a break before going on to another. 4. Having healthy lifestyle. Even if you are not suffering from burnout syndrome, you should still maintain a healthy lifestyle. These routines include eating a balanced diet, working out frequently, and obtaining adequate rest. Your mind and attitude are also impacted by what you consume in addition to your physical body. Avoid eating foods with a lot of sugar since the amino acid concentration may prevent your body from releasing the happy hormone serotonin. You should consume foods rich in omega-3 acids, such as fish and seaweed, to properly regulate your mood. Avoid drinking alcohol and smoking. Both can be used as a distraction to ease emotions, although the effects last only briefly. Overusing will actually make you feel worse. Due to its ability to lower the stress hormone cortisol, exercise can also aid in the recovery from burnout syndrome. You can begin regular exercise or something more practical like light exercise and jogging. 5. Mindfulness. Being mindful is keeping your attention on what you're doing instead of dwelling on the past or how it might affect the future. Those of you attempting to overcome burnout syndrome will find this attitude to be of great use. The intention is to banish all the negative thoughts that frequently give you anxiety and encourage you to pay more attention to your task in order to avoid making mistakes. By adopting a mindful mindset in daily life, you will be better able to focus on the task at hand without worrying too much about the outcome in the long run. The most crucial aspect of having this mentality is being aware that you are giving it your best. Overcoming burnout syndrome requires a process because it does not just disappear suddenly. Contact a doctor or therapist straight away if the aforementioned techniques do not work for you so that they can determine the best course of action. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting, Sunbro.